Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
So welcome. My name's Lauren Walsh. I'm the program director here with Cancer Support Community Atlanta. And today we have Savannah, a dietitian with Northside. Savannah is the high risk and survivorship dietitian, and she does these seminars with us every month, her or another oncology dietitian, and she does other programs with us. So it's always great to have Savannah. If you've never participated in our nutrition seminars before, we use this PowerPoint as a guideline. At the end, we always have time for question and answer. So please, if you have any questions at the end, you can take yourself off mute or put them in the chat. We welcome questions. This is your time if you've had something on your mind to ask a dietitian. So thank you, Savannah. Thank you all for joining us today, and I'm turning it over to you.
Perfect. Thanks, Lauren. And thank you guys for being on today's chat. I know it's a smaller group of us today. So with that being said, if you are comfortable, we want this to be, like Lauren said, your time, and we want you to get the most out of it. So if you're comfortable and you want to pop in the chat whether or not you're a caregiver or a patient dealing with decreased appetite, that way we can just kind of support each other, and I can really gear this presentation for you as we go along, but no pressure either way. So as the title suggests, we are talking about decreased appetite. This affects so many of our cancer patients. And so we want to make sure that everyone feels informed about how to handle this and prevent, maybe some of the negative consequences that come from a decreased appetite. 1 second. Here we go. So today we're going to just go over a couple of the possible reasons why we might not be very hungry, as well as understand why it's important, especially during cancer treatment, to maintain a proper food intake. So of course, to help with that, I'll give you some strategies to help up or increase your food intake, as well as some good little meal and snack and supplement ideas. We'll also talk about, some guidelines or questions to ask yourself so that you know when you maybe need to ask for help from an outside source. So maybe your oncology dietitian or your oncologist with this. Okay, so decreased appetite can be caused by several different factors. The first and most notable is the cancer itself. So depending on what kind of cancer you have, that can, and the location of the cancer, that in and of itself can cause a decreased appetite. Many patients might even experience some loss of appetite prior to diagnosis. So it can actually be one of those symptoms that maybe helps point doctors and physicians to the direction of what it is that's going on in your body. Of course, cancer is very stressful physically as well as mentally and emotionally, and that can certainly impact our appetite, cause us not to want to eat or even have the desire to eat. Pain is also a big reason for decreased appetite. If you're struggling and in pain, that's so often all you can think about. And so your hunger and your fullness cues might not be communicating with your brain as effectively. Nausea is another great example of decreased appetite. Whether you're a patient or a caregiver, everyone has experienced nausea. And when that happens, the last thing you really want to do is eat, even if someone's telling you, hey, let's just get some saltine crackers in or some toast. That can be really a challenge. Dehydration can also mask our hunger and our fullness cues. In some cases, dehydration actually ramps those cues up because it's hoping that you get hydration from your food, but many times it can actually mask your appetite. Medication and treatment side effects, and this is another heavy hitter for our appetite. Unfortunately, just many medications, their side effects cause the dehydration or cause the nausea, or maybe in some cases even pain that can make it difficult to want to eat. Changes in our bowel movements can also affect our appetite. So if you're struggling with constipation, alongside that comes a feeling of fullness that makes you not want to put any more food in your stomach. And then same with diarrhea. If you feel like every time that you eat something, it's running straight through you, you're having to run to the bathroom and it's disrupting your day, that's going to create less incentive to want to eat. Taste and smell changes, as well as mouth sores, or really just changes in our oral composition while we're dealing with cancer and cancer treatment, can absolutely affect wanting to eat. It can make the food that we usually love not taste great. And foods maybe we tolerated in the past can also, become big no-nos in our diet. Of course, if you're having any swallowing difficulty, like if you're going through radiation to the upper part of your body, swallowing difficulty can be an issue. Or if you are dealing with head and neck cancer, that is, a side effect of that cancer in and of itself. And lastly, so many cancer patients struggle with fatigue. So that just poor energy, you don't even have the desire to prepare food or even just sit there and feed yourself. This can have a really big impact on our appetite. So as you can see, there are many different reasons that cancer and cancer treatment can cause a decreased appetite. So, hopefully, or if you're on this call, you've probably already experienced some decreased appetite. And if you haven't, this is still a great webinar because it can give you some tools in your tool belt in case this day ever does. So why is it so important that we make sure that we're eating enough? Sometimes I'll have cancer patients and they'll say, I'm not eating very much, I'm losing weight, but I needed to lose weight. I wanted to lose weight prior to cancer diagnosis. Well, depending on your situation, maybe some weight loss is appropriate, but we certainly don't want that because you're not able to eat or you're having, one of the side effects that we just mentioned that's really affecting your quality of life. The goal with nutrition is to actually maintain your body weight or your muscle mass while you're going through treatment, as well as your body's store of nutrients, so we can help keeping your body function at its fullest capacity. When we stay adequately nourished, we feel better during treatment. And we also have greater strength and energy that can help us continue as many of our typical activities of daily living as possible, or even just having the strength to get to and from treatment or radiation. Research tells us that when we stay well nourished, when we maintain our muscle mass, we're maintaining most of our healthy body weight, we're actually better able to tolerate treatment-related side effects. So sometimes, staying more nourished, for example, can actually help stave off nausea and some other side effects as well. Okay, so we can actually prevent delays or breaks in treatment, and nobody wants to have to put a stop or a pause in their treatment. Typically, we want to get through it, as quickly and as healthily as we possibly can. Oftentimes, our treatment medications are dosed based on our weight. So if we lose a lot of weight, your oncologist might have to kind of pause your treatment and redose it. And that might mean that it's going to take you longer at a lower dose to get through the treatment that they wanted you to get through. Now, cancer cachexia is a syndrome that affects up to 80% of patients with advanced cancers. And this is something that's marked by a decline in skeletal muscle, and this may or may not occur with fat loss. So maybe you feel like the fat stores in your body are still intact, but you maybe notice that you're having a harder time participating in certain activities. That can be a sign that your muscle mass is declining. So an example is maybe you're having a harder time climbing the stairs, like you need more support with the handrails, or you need to go slower than you used to before diagnosis. Or another easy test to determine if cachexia is possibly happening to you is if you're struggling to get out of a chair without assistance, whereas before treatment, you could stand up and sit back down in a chair with ease. So again, we want to stay well nourished so that we can prevent this cachexia and hold on to as much of our muscle as we can. So some signs of decreased appetite, if you're the patient, you might be able to easily tell these in yourself, but if you're a caregiver, it's important to know some signs to look for in your loved one or the person you're caring for to determine if they're starting to have decreased appetite. The first one if you just have little or no interest in food, including some of your favorite foods. If you're going out to your favorite restaurant that you usually celebrate birthdays or special events, and you just don't really want to touch the food, and you just don't really feel like eating, that is definitely a sure sign of some decreased appetite. Of course, weight changes is another easy way to tell it if your appetite is decreased. Not everybody who experiences weight changes has decreased appetite, but most people do. So it's important to monitor your weight. 1 to 2 pounds, 1 to 3 pounds a week change isn't too abnormal, but if you're consistently dropping your weight from week to week, then that's a sign that you might not be getting the nourishment that you need. Lastly, if you're experiencing changes in your meal schedule, for example, if you're skipping meals like breakfast, or you used to always have a big lunch and now you're just having a snack midday, or maybe you used to do a lot of late night snacking and now you have no desire for that, that can also be a sign of decreased appetite for you or the person you're caring for. So I want to give plenty of strategies, now that we've identified, hey, maybe I have decreased appetite, maybe your doctor's already brought this up with you, you've seen changes on the scale. Let's come up with some tips so that we can maintain or possibly regain our appetite while we're going through treatment. So strategy number 1 is to try to use the clock to your advantage. Meal timing can be really helpful. So traditionally, most people eat 3 large meals and then maybe some snacks if they're a snacker. But if you are having poor appetite, it can be really hard to get all the nourishment you need in just 3 meals because your meals are probably a lot smaller than you're used to. Instead, we recommend trying to eat smaller meals throughout the day. So typically this is about 5 to 6 meals spaced about 2 to 3 hours apart from each other. In order to make sure that this happens, to help make sure that you're getting those 5 to 6 meals, we don't recommend relying on your hunger and fullness cues because at this point, they're probably not firing the way that they're supposed to be. Instead, we want to either schedule your meals or possibly even set an alarm to remind you to eat instead of waiting until you're hungry. Because sometimes you might be waiting hours or even days before you get hungry again. Another tip is to put in a bedtime snack into your routine. This helps to give you some extra calories without affecting your appetite at breakfast. I do recommend doing this about 30 minutes before bed and then sitting upright just so you have time to digest the snack and so your digestive system isn't keeping you awake in the middle of the night. And then lastly, when you know that you feel the most hungry, go ahead and use that to your advantage and try to have a bigger meal at that time. For a lot of people, this is breakfast. So trying to have a bigger breakfast can help kind of get your day started on the right foot. Okay, food preparation is our next strategy. We want to keep our pantry and our freezer really well stocked with foods that either are pre-made or pre-packaged. So all you have to do is kind of grab it and go whenever that alarm rings, telling you to eat a meal or when you do feel hungry. So I'll give you some examples of snack ideas later on, but just a couple examples of what I mean by these pre-made are things like individual guacamole cups or string cheeses or hard-boiled eggs. Things that don't take a lot of preparation. Especially if you are feeling very fatigued, you don't want to be in the kitchen preparing 6 meals or 6 snacks each day. That's not super realistic. Now is as good of a time as any to ask for support from your friends, your family. See if you can maybe get a rotation going, friends or family bringing you a meal, however often you need it, whether that's weekly or a couple times a week, just to help take some of that burden off of you for having to meal prep. One tip for this is to come up with a list of some of your favorite recipes or recipes that are working for you while you're going through treatment and providing that to your friends and family so they have a guideline of what you like and what's going to be good to prepare for you. And then, of course, if you are preparing food for yourself, go ahead and batch make some of those meals. And freeze them. So, for example, like soups or chilies are really easy to make in a crock pot and then freeze several servings so that later down the line, you can just pull it out of the freezer and heat it up and you're good to go. Okay, so some more cold snack ideas, things like chicken or tuna salad, cheese and crackers, or even a cottage cheese paired with fruit. Pasta salad with some chicken and maybe even some olives in there for some healthy fats. And then things like hummus with crackers or vegetables, grapes, cheese, and olive snack plates, or even like a frozen yogurt or an ice cream. You probably don't expect a dietitian to tell you that. But frozen yogurt or ice cream can be a great choice to get some extra calories. So just what I was saying was during this time, in order to get more calories in, choosing higher fat products can actually help you to do that. So previously, maybe you were choosing a reduced fat dairy product like a skim milk, but now might be a good time to switch to a whole milk product like a whole milk yogurt or cheese to help get in some extra calories without feeling too full too quickly. Same concept applies with condiments, dips, spreads, oils. For example, adding like avocado to a sandwich instead of mustard can give you some extra nutrition during that meal. I'm going to jump back to our next strategy is using liquids to your advantage. So there is a little bit of a strategy when it comes to liquids. What we don't want to do is try to drink a big glass of water with our meals. If we do that, we might feel too full if we eat and drink at the same time, and then we don't have any room for our food. A better plan is to drink liquids throughout the day, even when you don't feel like eating. Sipping on your liquids, using a straw might help you. That can help you stay hydrated. And as we mentioned earlier, dehydration can affect our appetite. You can also choose liquids that are going to add calories and other nutrients. So, for example, that milk that we just mentioned, or some fruit juices might add some extra calories that can also help sneak in a little bit more to help you maintain your weight. We can also choose high-calorie, high-protein beverages like smoothies or milkshakes that you're making at home. Or you can also consider purchasing oral nutrition supplements to help you get a little extra liquid nutrition in during the day. So I have a slide on that. Okay, so I want to give you some of these liquid ideas. So again, milk and fruit juices are great choices. I do want to let you know if you prefer a plant-based milk, usually your almond and your oat milk will give you a little bit of calories, but not very much protein. So a better option to get some protein in is going to be soy milk if you prefer not to do dairy. Adding a packet of Carnation Instant Breakfast can also help you get some extra calories and nutrition in. And then again, homemade smoothies or milkshakes. There are also so many of these oral nutrition supplements on the market. The most common are Ensure or Boost, or if blood sugar is an issue for you, Glucerna is one that's made specifically for individuals with diabetes. But if you've had these before or you just have a bad association with them, there are other products you can try. Premier Protein and Fairlife are two that are pretty popular. Now, they're not going to give you as much of the vitamins and minerals as the Ensure or the Boost will, but they tend to give you a decent amount of protein. Orgain is another product, and they have both animal and plant-based protein sources. All right, strategy number 5, managing taste changes. Many individuals who are dealing with taste changes as a side effect actually do better with tart flavors versus sweet. So things like lemon wedges or lemonade or other citrus fruit and even pickled foods can be a little bit more manageable taste-wise. If you are having mouth sores or a sore throat, you do want to avoid these foods because it can irritate them. Marinating foods can also help with taste changes to give it a new flavor palette. Or try sucking on sugar-free lemon drops, gum, or mints during the day. And that can also kind of help, keep a better flavor in your mouth if possible. If you're struggling to drink water, it's a good idea to add lemon juice or any other fruit or even a flavoring agent to the water for it to taste better. Don't be afraid to season your foods with things like herbs and spices. This is really your preference based on what you prefer. And then for some frozen fruits, such as like frozen grapes or frozen melons, can also taste really good, or even a little bit more mild in their frozen form versus their fresh form. If you've dealt with either mouth sores or taste changes, you can try this homemade mouth rinse that acts like a really gentle cleanser. I recommend using it before and after meals to kind of gently cleanse your mouth out so you have a fresh palate before you eat. So this rinse is a quart of water, which is 4 cups, a teaspoon of salt, and a teaspoon of baking soda. So you just use this exactly how you would as a mouth rinse. You just swish and spit. And then if you are struggling with a metallic taste, try using plastic. I know it's not the most environmentally friendly, but it'll irritate your mouth and your taste buds significantly less. Okay, a few last minute tips and strategies I want to give you all before we move into questions. Move around when you can. Even just gentle exercise and movement can help increase your appetite. Also, try to make your meal times really enjoyable if you can. Have a nice table setting, play some music or a podcast, or try to eat with loved ones to help encourage you to eat and maybe get your brain off of, your lack of appetite. Again, make sure to use that clock. You can also use things like commercial breaks on TV as a cue to pick up the fork and continue eating part of your meal. Or even using your pet's feeding schedule. If you're feeding your pet twice a day, that's a good reminder of, hey, have I eaten today, or have I really kind of forgotten everything? Then lastly, if these strategies aren't working for you, or you're really, really having a hard time, Make sure you're discussing this with your physician, and you can also bring up the concept of appetite stimulants or medications that might be able to help. Okay, lastly, on the same wavelength, know when to ask for help. So some signs for you as a patient or if you're the caregiver that you might need to bring this up with the physician is if you've been feeling nauseated and can't eat for more than one day, if you've had unintentional weight loss of more than 3 pounds in a week, if you're having any pain when you're eating that you think is coming from the process of eating, if you haven't urinated for an entire day, or if you haven't had a bowel movement in 2 days, definitely want to bring that up with your care team. If you're frequently vomiting, or if an episode of vomiting is occurring for more than 24 hours, you certainly want to bring this to your team's attention. Or if you're having pain that's not well controlled. So these are all things that you want to bring up with your physicians. Now, if you are a patient of the Northside Hospital Cancer Institute, your treatment center or radiation center should have a dietitian available to you. So you can ask for a referral in your clinic if you haven't already, or you can email us at outpatient.nutrition@northside.com. We just ask that you provide your name, date of birth, and location for where you're getting treatment so that we can plug you in with a dietitian who can keep working with you on your reduced appetite or any other nutrition symptoms that you might be dealing with. Now, if you're getting care outside of Northside, you probably do have dietitians available to you as well. And we can also try to help plug you in or get you the contact information for those dietitians if you're struggling to locate someone. So we are here to help you. These seminars are so great, but working one-on-one can really be beneficial if you're really struggling and not seeing the improvement that you want to be seeing.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.